Hey everyone, welcome back to the NJRI channel. It's Dr. Bowen here, and I'm a board certified physiatrist. Today I'm going to be speaking about MFAT. It stands for microfractured adipose tissue. This is the second video in a series my team and I have kicked off from last week, titled The Good, the Bad, and the Truth About Regenerative Medicine. Last week I talked about PRP, or platelet-rich plasma. You can click here to watch the video. MFAT is one of my preferred treatments, so I wanted to focus today's video on the reasons why I love this procedure. As we go through each of the reasons, I'll review the good, the bad, and the truth about MFAT. So let's get rolling with these 5 things. So if you like this content, please support us by hitting that like button and subscribing so you won't miss any of our videos. Let's start at number 5 for the countdown. So for number 5, I love MFAT because of the patient's response to the process. MFAT uses your body's own fat cells to fill in the gaps or defects and may secondarily stimulate healing and repair. It most likely has an immunomodulatory effect to balance out inflammation. Inflammation is often discussed as bad, but it's actually God's gift to us to heal. Think about cutting yourself. There's inflammation after the injury, and this is the process needed to heal. But we don't want the other end of the extreme, such as a rheumatologic issue like rheumatoid arthritis, where the bad inflammatory cells actually create damage to the joint cartilage. For the MFAT procedure, I take a small amount of fat from you, usually from the abdomen or thighs, and then we process that fat to isolate it, clean it, and resize it so the fat will fit through a small needle that we can deliver then back to the target site. These cells contain a wealth of growth factors and the cells that can control pain and likely promote tissue regeneration and repair. The good news is that this method taps into your body's natural healing responses, so it fits perfectly in line with NJRI's overreaching goal to unleash your intrinsic ability to heal. But there's bad. Like any process or procedure, results can vary. Some patients experience fantastic improvements, while others might not see anything more than modest results. The truth is, while MFAT has shown great promise, it's not a one-size-fits-all solution, and the outcomes can depend on various factors, including the specific condition being treated and individual health conditions. Another bad thing about MFAT is that in some of my athletic population, those patients just really aren't a good fit for the procedure because you just don't have enough fat. Thus, they're not eligible for the procedure. In the United States, all regenerative treatments must be autologous or go through the FDA's regulatory process if they're not. Autologous means that the cells come from the tissue from you and go back to the same individual that's undergoing the treatment. So we can't just take someone else's fat and use it for a different individual. Now let's review the next reason why I'm a huge fan of MFAT procedure. MFAT is minimally invasive compared to traditional surgical options. The procedure involves a small liposuction, which is the same as any cosmetic procedure, that harvests the fat and then can be used for a simple injection procedure to deliver that micro-fragmented tissue into the treatment area. This means less downtime and a quicker recovery. You can often return to your daily activities sooner compared to other more invasive surgeries. Most of our patients are in the office for about 2 hours, which includes the paperwork and the logistics, and they only need to take off a few days of work afterward. About 50% of my patients with knee arthritis have it bilaterally, which means that they have pain in both the right and left knee. Out of this 50% of patients, most have enough adipose tissue to allow me to do both knees at the same time. This is a more efficient option with less downtime and expense, rather than having 2 separate procedures. Other operations for knee arthritis can cause a significantly longer recovery period. However, the bad news is that a minimally invasive procedure doesn't necessarily mean that it's non-invasive. There are still risks of infection, bruising, and swelling. Most patients have little to no complaints of the knees after the treatment, and most of the issues that I see are related to the harvest site area. The truth is, while it's less invasive than surgery, it's not without its own set of potential complications, which is why it's essential to follow the post-procedure care instructions I give you closely. As with all orthobiologics or regenerative procedures, I recommend avoiding non-steroidal anti-inflammatory medications like Advil, Motrin, or Aleve. After the procedure, I tell my patients to ice the area repetitively, Wear a compressive garment over the area that I took the fat from. And usually beyond that, there's no restrictions for the knee or otherwise. One of the standout features of MFAT is its versatility. It can be used to treat a variety of conditions, from joint pain and arthritis to tendons. This wide range of applications also makes it a valuable tool in regenerative medicine. While our channel has focused mainly on the knees so far, we also treat a ton of shoulder issues. My partner, Dr. Thomas Agason, is an expert on the shoulder treatment, and in coming weeks we'll start rolling out videos on how he uses and the versatility of MFAT to treat most of the shoulder conditions that we see. On the flip side, the bad news is that the effectiveness can vary depending on what we're treating. Much like I reviewed in the PRP in the last video, it can work wonders for some, but it's not always effective for others. Large tendinopathies with tearing, like partial rotator cuff tears, tend not to respond too well to PRP, but they often respond very well to MFAT. Like I said in the last video, it's important to find a good doctor to make the correct diagnosis, and that will work with you to decide which treatment option is the best for you, with all the pros and cons. Here at NJRI, I do a thorough evaluation with my patients before recommending any treatment or procedure, and sometimes we need additional diagnostic tests before we can do that. Since we're a small practice, I have the time to sit down with you and explain what I think is the best option for getting you back to full health. If you feel like PRP or MFAT may be right for you, give our office a call to schedule an appointment. Next up, at number 2, one of the reasons I'm enthusiastic about MFAT is its potential for reduced side effects. Because MFAT uses your own cells, the risk of allergic reactions or severe complications is generally lower compared to products involving foreign materials or substances. The cells are biocompatible with your body, which means they're less likely to cause adverse reactions. However, the downside is that while side effects are minimized, they're not entirely eliminated. Some patients might still experience mild discomfort or transient side effects, such as temporary swelling or minor pain at the injection site or where the fat is harvested. The truth is that while MFAT reduces the likelihood of major complications compared to other treatment options, it's essential to monitor your body's response and report any unusual symptoms to your healthcare provider promptly. At NJRI, I will call you after the procedure to see how your experience went, how you're feeling, and to address any concerns you have. The usual time frame to start to notice any improvement is around 3 to 4 weeks. Therefore, I typically see people in the office at about 6 weeks after the procedure to consider options that capitalize on this improvement, such as corrective exercises or physical therapy. But patients are always free to give us a call and see us sooner if needed. And finally, at number 1, the thing my partner and I most love about MFAT is its potential for long-lasting results. Many patients find that MFAT provides durable relief and improvement in their symptoms, often seeing benefits that last longer than some other treatments. This longevity can be particularly valuable for conditions like chronic joint pain, where sustained results are crucial for the quality of life. Typically, my patients get 3 to 5 years of benefit with MFAT, but also I've seen people with over 7 years of benefit, and that's when they come back for a new problem or some return of those old symptoms and want repeat treatment. We also continue to collect data on all these treatments so we can get more details about the duration of response and help us in our discussions with picking the right treatment for our patients. Some patients may need a follow-up treatment to maintain those benefits over time. The truth is that while MFAT can offer lasting improvements, it's not a guaranteed permanent fix, and ongoing management might be necessary depending on your condition and lifestyle. There you have it, the 5 reasons NJRI and I love MFAT. For its long-lasting results, reduced side effects, versatility, being minimally invasive, and its potential regenerative power. Thanks for tuning into this video on the 5 reasons NJRI loves MFAT. Remember, while MFAT has many advantages, it's important to discuss all the potential outcomes and alternatives with your healthcare provider to find the best treatment tailored for your needs. If you have any questions or are considering MFAT or any other treatment, don't hesitate to reach out to our office and schedule an appointment. Be sure to like, subscribe, and hit that bell notification to stay updated on our latest content. Additionally, take a second to follow us on our socials so you never miss any important information like our office closures or new clinical trials. You can find us on Instagram, Facebook, X, Twitter, and TikTok. All of our accounts are linked below in the comments section. Thanks today, folks, for all you tuning in. Any questions, comments or things you'd like to relate, just put them down in the comments. We'd love to read them so we can address them.